And I did my part. I went to the best, most fanciest doctor in Dallas who was on all the magazines. She had all the awards and all the degrees because this is the baby I had worked for years. I completely transformed my body to carry this baby because I don't know if I'll be able to have more. So you do everything right and you spend all the money for the best of the best of the best, and you're still treated like you're just another stupid girl. And that pisses me the fuck off.
Hey, this is Micah Larson with Modern Hysteria, and we're talking about a topic that a lot of people don't want to believe is real, which is the erasure of women's voices in healthcare, especially during fertility, pregnancy, reproductive, and mental health care. And here's the taboo: how even the most educated, prepared, credentialed women, like today's guest, are still being dismissed by the very systems that claim to care for them. Dr. Cyntia Brown is an integrative fertility pharmacist, a Nigerian-American woman, and somebody who has experienced the medical system from two sides, as patient and practitioner. Now she supports clients through fertility treatment and medication decisions by doing case reviews of complex drugs they may be on and untangling the side effects like those from hormonal birth control. But when she was pregnant herself, she was made to feel like she didn't know her own body. If she hadn't had gotten a second opinion, she might have had a very different outcome. And here's the hard truth. There are fabulous healthcare providers, and there are less fabulous healthcare providers, just like in any industry. But in medicine, the consequences can be deadly. This podcast is pro-evidence-based medicine, pro-Western medicine, and empirical research and pharmaceuticals when appropriate. And we have to recognize that there are systemic issues that disproportionately affect women's health, and in particular, women of color. And when we are prescribed mind and body-altering substances, this really friggin' matters. Cyntia, Dr. Brown's experience is not an outlier. It illustrates the disproportionate harm Black women face in pregnancy, birth, mental, and maternal health care. Cyntia is a PharmD, and her experiences as a patient are an example of how systemic bias can override expertise and medical literacy and experience. So if someone like her is ignored or gaslit, what happens to someone without medical knowledge who can't advocate as well for themselves? This is something I've thought about too. I have layers and layers of privilege, including medical privilege, because I'm married to a physician, and I have no doubt that my case would turn out differently if I wasn't riding on his coattails and had him to advocate for me. So Cyntia and I talk about that and how medical misogyny and racism are a deadly combination. Black women in America are 3 to 4 times more likely to die from pregnancy-related causes than white women. And we're living in a time when we are seeing pregnancy-related deaths increase. But for women of color, it is racism, not race, that is the risk factor. Even the most highly educated women are routinely dismissed in reproductive and mental health care. No one wants to talk about how deeply the systemic oppression goes. We're not supposed to question top-rated OBs. We're not supposed to talk about how often we feel lied to, ignored, or harmed, especially when pregnant. And we are not supposed to say that birthing and pregnancy is often a source of trauma, not empowerment. And we are definitely not supposed to talk about how racism and misogyny can shape our medical outcomes. This episode is about helping you recognize when you need advocacy from yourself, from someone else, to ask the right questions. And whether you're planning a pregnancy, you've had a pregnancy, you want nothing to do with pregnancy, you just want to better understand what's going on in your body, on hormones or oral birth control, this is a conversation for you. It's actually a two-parter because Cyntia and I covered a lot of ground. So next week, season 1, episode 20 will be the second half of this interview. Before we dive in though, quick heads up, this episode includes personal stories of medical trauma, pregnancy complications, and ways our healthcare system often fails women, especially Black women. So take care while listening. I'm Micah Larson, and this is Modern Hysteria. Let's get to the episode.
I'm Dr. Cyntia Brown. My pronouns are she, her. and I am an integrative fertility expert.
So can you tell us, how did you get there? What was your background? Like, how did you become so passionate about helping people trying to conceive?
So the integrative part of the integrative fertility title, that it comes from my marriage of not only like Western medicine, but also holistic health. So that way you don't have to pick or choose. You can have the best of both worlds. That's kind of how I call it. As far as my journey to what made me enter this field, it's really a little selfish. It's because of my own experiences with my own fertility problems. I have a history of ovarian cysts and fibroids, including getting a fibroid when I was pregnant that threatened my pregnancy.
A quick aside, because I want to expand on this. What is the relationship between estrogen, fat, and fibroids? First, fibroids are non cancerous, benign growths that commonly grow around the uterus, and they are sensitive to estrogen. Estrogen is a hormone that's stored and produced in body fat and after puberty for women and people assigned female at birth. It's usually the dominant hormone that stimulates our uterine tissue growth, including fibroids. And higher body fat equals a higher risk of fibroids. Multiple studies link obesity and high BMI, body mass index, to increased fibroid risk. One analysis found that women with a BMI over 30 had a 2 to 3 times greater risk of fibroids than those with what is considered a normal BMI. And huge caveat, as usual, BMI is not a great measurement of body fat or overall health. While high body fat increases estrogen, and not everybody with a high BMI will develop fibroids. Genetics, other hormonal factors play a role here, and fibroids can persist even when your estrogen levels decline, like when you are in perimenopause and menopause. So estrogen is a major driver of fibroids, but it's not the only one.
I think my experience of having to be shuffled between doctors, having my pain from my cysts ignored, and just being told it's part of growing up. I mean, I had a doctor telling me that my body is changing whenever I'd complain about my ovarian cysts pain. And this is pain to the point where when I moved, I would feel a sharp pain in my pelvis. And she told me, well, your body is just going through some changes right now. And I'm thinking, I'm 24. I don't know. Am I still going through puberty? I was shuffled between so many specialists just because no one wanted to take the time to stop and talk to me and really listen to me. When I finally found an OB who would do an ultrasound and they found the cyst, my only option was birth control. They very immediately pushed me on birth control. And I have no qualms about birth control. I think it can be a very useful tool. But the medication that she put me on was something that she sponsored. And I did not know that. And I didn't know until I went to the pharmacy and it cost with a coupon a little under $200. And the coupon was only good for the first time. So when my 1 month supply ran out and I went back to her for a refill and she refused to give me another coupon, and was seeing all of the little sponsored ads for the birth control. It was like a mini pill or something. It was supposed to be like, I think, low estrin. And I went to the pharmacy and I didn't have a coupon anymore and it cost almost $400 out of pocket. But I thought, well, I need this to fix my cyst. I cannot have a baby in this condition. I need this life-changing medication. And birth control can be life-changing. It wasn't until I entered pharmacy school and I really learned more about women's health and I understood our system better. I understood the medication better. And that year, I was 26, I focused in on healing my body because I knew I wanted to be a mother. I've always known I wanted to be a mom. But at the time, I was hypertensive, I was diabetic, I had sleep apnea, and I had joint pain. And something I've learned since is that extra fat is fueling the estrogen, is fueling the cysts, is fueling the fibroids. And so I focused in on healing myself because I wanted to be fit and healthy enough to carry a pregnancy to term. And I already knew because of my own medical history and my family's history, we have a very big history of hormone issues. And all my sisters, we were all on birth control for different hormone disorders. My mom, my aunts, all history of miscarriage, cysts, fibroids. So over the course of the next year, I lost 55 pounds. I was no longer hypertensive. I was no longer diabetic. I was very, very proud of my A1C for the first time.
Micah here with another aside because I want to talk about A1C, not to be confused with AOC. According to my research, A1C is a blood test that shows your average blood sugar levels over the last 2 to 3 months. And healthcare providers use it to diagnose and monitor diabetes and prediabetes. A1C is high when blood sugar stays high for too long. Okay, back to the episode.
I used to be someone who avoided that. And I basically collected not only the notes I had from graduate school, but what I learned from my own personal story to develop our method that we use now in Capella Health.
And can you tell us a little bit more about like what does it look like to have gone through that? And then now you studied pharmacology, you're a clinical pharmacist, right?
So I did my 4 years in pharmacy school. That's graduate school. And I did a postdoc fellowship in precision medicine and personalized medicine. So what that means is in my fellowship, I was really able to learn about the genetic drivers of health. Their focus is really on looking at each person individually, figuring out what does your DNA say about your health and how we can optimize each person's care at a personal level. And that's kind of where I got the support or like the idea about like why isn't fertility care more like this? It's not like a very large practice because medicine tends to follow kind of a cookie cutter textbook approach. So I was very fortunate that IU is more about precision care instead of just simply what dose. It's what dose, what time, what person, which I didn't know was a thing until I entered that program. So I took that kind of idea back into my own practice.
Okay, so fascinating because I'm wondering, Cynthia, what were you thinking when after you got all of this education and you're going back and looking at your experiences, what was going through your head when you're thinking about like the drugs that you were prescribed?
I think the thing is like so many doctors just dismissed what I was talking about. I mean, I even had that in my pregnancy where I was complaining about pain for months and being told that's just part of being pregnant. And I left that OB when I was 8 months pregnant. And I was lucky that I found midwives who on the first visit caught that I had a UTI for months that was spreading to a bladder infection. And I gave birth a little early because it had spread into my baby and he was born sick. But that doctor, I've been complaining, I'm having pain, I'm peeing every 20 minutes. You're stressed out. It's in your head.
Mm-hmm.
Another woman. I'm being gaslit by another woman. And I just looking at this, my experience getting pregnant, being pregnant, and I'm just like, it's just no one has the time to sit there and care and really analyze what's going on. That's the truth of it. It's easier to kind of check some boxes. And I think that's what happened with my OB. I was 29 years old, fresh pregnancy. I have no comorbid conditions per her screening. I'm not a complicated case. So if I'm complaining, why would she spend the time to look and possibly find a problem that she would have to deal with and start thinking about when I'm an easy case? Instead,
Mm-hmm.
she is happy to bill my insurance repeatedly. We were getting bills from all over the country. My blood sample, I was getting blood samples, but never a urine screen. We're in a major city, but yet we're, whatever. So I just feel like it's easier to ignore than to really look. You can focus in on what you can bill because often they don't get paid if they aren't billing. And it's kind of a lazier approach. You just checking a few boxes. Okay, you're pregnant, you're peeing a lot. It's nothing. Instead of
Mm-hmm.
pausing to really listen and look. And I think that often as women, we are so used to being told we're crazy, we're overreacting, we're being too sensitive, we're being too needy, we're being too whatever, we dismiss ourselves. We begin to believe the narrative ourselves. Like maybe I am just overreacting. I'm tripping. It's me. And you learn to not trust yourself. We're conditioned to not trust ourselves.
Absolutely. There's so many layers there about
Yes.
like
Sorry, I was like,
medical. No, this is great. I'm
you
because
walked in,
I'm
I'm like, you know what? And that's in the blood sample. That was my blood in Nashville. I was just, yeah.
yes. Okay, I'm following you. And especially the for-profit medical
Yes.
institution in which many of us live, like, but even outside of that, at non-for-profit medicine, like, providers are asked to do way more than they can possibly handle and to see so
Yeah.
many patients, and they aren't always allowed the time. There's so many things that we are up against, and like one of those layers being that women's pain isn't taken seriously. And you said something when we talked earlier that really stuck with me, which is I have the knowledge to advocate for myself clinically, but they still
Yes.
treated me like a stupid little
Yes.
girl.
And the thing is, I'll go in like, hey, I am a PharmD. I went to grad school. I did my fellowship. Can we talk as if not peers, colleagues? Like you can say the medical jargon and I can help you help me. That was what I thought was going to happen. I'd come in with questions because I will, concede I'm not an OB. There's things that I won't fully understand, maybe I won't fully know. So I will come in. I know the drugs, but I will come in humble and say, hey, I'm kind of lost here, but I can read a medical paper. I can interpret. I've done case studies too. You can talk to me. And each time, like, I asked about the epidural. I want an epidural. I didn't get one because my baby came fast and early, but I wanted one. But I just wanted to talk about, okay, what are the options? Here's what I'm reading in the literature. What do you think about this? And have a discussion, And she said, oh, so I came in with my notes. Oh, don't worry about that. I'll just give you a epidural. And I'm like, okay, I'm open to one, but I would like to talk about what my options are. I'll just talk. And she's like,
Mhm.
no, we're doing epidural. And I'm like, we? Who's we? I'm giving birth.
Yes.
You're
And you're like, I'm here with my PharmD, and
right.
I have questions for you.
Right, right, right. And I'm like, okay, well, what happens if my birth doesn't proceed? What do we do in situations like that? Well, I'll just cut it. Don't worry. I'm like, wait, you're just gonna like give me an episiotomy? Like I didn't. There's other things we can do. And as we're talking, and she's telling me, I'm gonna do this. I'm gonna do that. I'm gonna give you this. I'm like, she's not even seeing me as a person. I'm a case. I am patient, 1457 to her. This is her thousandth birth. This is my first. At no point did she say, I'm going to stop to ask you. I'll stop to talk to you. I will inform you. And that's what my midwives did. Even when I was giving birth and it was like unplanned and we were not ready, my midwife came in with her hair wet because she was not thinking I go into labor so quickly. So she was in the shower. They had to pull her out. And she still had time to pause and say, I know you're scared right now, but we need to push. Hey, I'm going to massage you right now. Hey, his head is here. Like she still had time to talk me through the birth. But with my OB, after this, like the 8 month visit, I was like, she's just gonna cut me. She doesn't care. She doesn't care. If at any point this is not going how she wants it to go, she will either give me a C-section or she will slice me from gooch to cooch. And
Mhm.
and that
Mhm.
scares me, and like,
Yeah.
so because just the way she was not even interested in having a conversation, the way that I could tell she was just waiting to get to her next person, my gut was just screaming. And I told, I had to just tell my husband, like, I don't feel good about this. I don't, because I mean, God willing, this is not our only child, but I'm going to go into it that this could be the only time I get to experience birth. So I want it to be done special and right. And the fact, yeah, I felt like this person doesn't respect my intelligence. And in the office, she saw a lot of young mothers or who looked young to me, I don't know, and a lot of immigrants. And that concerned me because I'm like, if this is how she's talking and treating me, you barely speak English. You're in your 20s. What's happening to you? Maybe you didn't need that C-section. Maybe it was just easier for her to cut you open because you weren't progressing fast enough. Maybe you
Mhm.
didn't need that episiotomy. Maybe you didn't need that epidural that early. Like, but it was just like she's like, okay, you're in here now. Let's shoot you up. I don't know. I mean, it's all speculation, but I will say after I left a Google review where I talked about how she dismissed me and how she missed my 4 month long UTI and talked about how she told me under no circumstances would she intervene if, God forbid, I were to miscarry. She would not help me because she's staunchly against intervening. So I'm like, okay, I think I'm going to share my experience. And after I put up my Google review, she had so much time for me. She called me. She left me so many voicemails. I got the attention I deserved because she wanted me to take it down.
Cyntia, that is
No,
real grim.
every time someone likes that Google review, I'm like, I hope I saved your life. I hope I saved your baby. I hope you find someone who loves you and who doesn't see your baby as, case number five. I hope that they always treat your baby, your pregnancy. I don't care if it's your 10th pregnancy, that it's like the first one. She is one of the best rated in Dallas, according to every metric that I saw, because I tried to pick the best I could find. But I think a lot of doctors have lost the humanity of medicine.
I'm so sorry. And so now in your practice, like patient advocacy is so important for you now, right? Like that is such a driver of your work because you have had these experiences and you know so many other people have.
Yes. I know the pain because it was happening in my body too. I know the fear of a miscarriage. I know the fear of not being able to carry to term. I know how you feel when you are pregnant and you wake up bleeding. I get it. So, and I try to remember that. And I don't want to ever lose my own human touch. So I limit how many clients I take on into my fertility program because I want to make sure that I have full time for you and like I'm never overextended. You have all of me. You're working with me because you need a bulldog in a skirt. You need someone who ask the questions. I don't mind being annoying. I'll call your OB for you and be like, "So why'd you order this test? Because that doesn't make sense." Just like the client we were telling you about who to improve her progesterone levels, they gave her a progesterone mini pill and she was trying to conceive. And finally, when we talked, and I said, "Well, you're on birth control," and she was like, "No, this is just to increase my progesterone and help my lining." I'm like, "Well, yeah, it'll do that because your body will think you're already pregnant. You can't conceive on this. They give this to women after they give birth, who are still breastfeeding, so that they don't get pregnant again. I was on this after I gave birth." And she had
Mhm.
no idea. And that's a real trend I'm seeing is women who are on medication and they don't know why they're on it. They're just told to take it.
Micah here again with an aside about progesterone. The progesterone mini pill is a common type of oral birth control that contains only progesterone, not estrogen, which are both important sex hormones that occur naturally in the body. And it's often given to people who are breastfeeding or people who can't take estrogen for medical reasons like endometriosis. Here's the problem. So the mini pill makes your body think that you are already pregnant. That means it stops ovulation and it keeps you from conceiving. So instead of boosting fertility, it can prevent it. And for this particular client, Cyntia referred to, no one had explained that to her. I personally have been prescribed progesterone twice. Once the mini pill without understanding the side effects, which include ovarian cysts, which really hurt. And then in 2024, not understanding that for people with PMDD, premenstrual dysphoric disorder, progesterone can lead to depression and suicidality. And 1 month later, I was in the mental hospital. The point is, progesterone can both stabilize and destabilize your mood depending on dosage, timing, sensitivity, life stage, and your provider should look at like the whole picture, the whole context to know if it's right for you at any point in time. Also, we don't have any risk-free oral birth controls. Our current options can provoke mood symptoms, and a lot of times we don't know that when we are prescribed it, especially for if we are prescribed it really young. Okay, back to the episode.
Women who were having procedures, like, wait, why did they cut into me? Or what part of me did they take out?
Mhm,
And
mhm.
I'm just like, oh my God, because or even just like one client, I was just translating her labs and helping her understand what was going on here. They're ordering this for this, they're doing this for that. They didn't actually order any fertility labs for you. And she was like, what? I'm like, well, they ordered like the baseline stuff. So we know you're healthy. We need to know about like your AMH. We need to know about your estrogen levels. We need to know your FSH, like LH. And she's like, wait, what's all that? And I'm like, that's the actual fertility part of the fertility labs. So I think that's my form of advocacy too, is an education and helping you know where you're being poorly directed.
Okay, Cynthia, I'm getting emotional hearing you talk about that because I am a full believer in the power of Western medicine and allopathic medicine. And I'm critical of the system in which, like, so many of us are not literate in it. And we're making these huge decisions. And like you
Yeah.
said, people are on medication and we're just like, go with it. Like I told you the other day, I was on 100 milligrams of progesterone daily after I had a radical hysterectomy. And do you remember what you said? You were like, that can cause
A lot of
psychosis.
psychosis.
And I was like, oh my God. Okay, well, like I ended up in the mental hospital.
Yeah.
And
You're just
it
being a
was
silly girl. You're just being a silly girl.
I'm being a silly girl. And it was like, why did I have to figure that out? Okay, that was just an example of like
Yeah, I
you and
know.
I
It
just
makes
were
me
on the
start
phone.
thinking like, wait a minute, what the
Yeah, exactly.
you
And
start the pieces start coming together, you start being like, wait a minute, and then that time, and then that time, and it's like, yeah, girl, you've been abused. You were a
yeah.
victim.
And like that makes me like I'm thinking of you as like the angel who's like coming along with people on the okay, I'm getting goosebumps. Girl, I'm about to cry. Okay, because like we need someone who is literate in these
Yeah,
things who can say like this is not right, or like you do case reviews for your
yeah,
clients of
yeah,
like okay, this
yeah.
is where we went wrong. Like this was
Yeah,
inappropriate.
because I can write clinical notes too and bring it to your OB and be like, this is what this person thinks, and this is what she has for me. Why aren't you doing this? Or what do you think? Because some of it is like, because you cannot speak the talk, you can't advocate for yourself. You don't have the tools to fight back and question their logic. All you can do is, well, why? That isn't enough sometimes to garner respect because some doctors forget that they are agents of change. So I like being able to empower my client. Like, even if we only do a case review and we don't talk ever again, you at least have a tool now to say, well, I have a second opinion. Here are the notes. Let me see your notes. You can ask for their notes. I asked for my OB's notes. And not only did she never ordered any urine screening, she didn't even note that I ever complained to her about my bladder pain.
Which like a UTI is a very common thing. Like
Hey, it
I
wasn't
don't
even fucking
understand.
crazy complicated. And it's common amongst pregnant people, especially. But a raging UTI for 4+ months is. I asked for. Let me see your notes from my very first intake. All normal, all normal. Patient has no issues. Patient asked no questions. Yes, the fuck I did, bitch. Like, what are you talking about? Like, I notoriously am loud and annoying. I ask questions, yes. And no remark about any discomfort. All normal, patient's happy, all normal. So she's billing my insurance. Blue Cross is like, okay, you're doing a great job. Here's your money. She's doing great. She's then why was my baby born with pneumonia and in the ICU for a week if everything is totally fine? He was bathing in bacteria for months. Why was he born and he could not breathe? And again, I was advocating for myself. I was talking, I was asking questions, and I was still ignored and dismissed every step of the way to the point where I had to flee at 8 months pregnant. And thank God I found wonderful midwives who caught the UTI because God, what worse, maybe he would have when he was born, the umbilical cord was already shriveling. My husband saw it because it was already dying. So he was like barely 5 pounds because no one cared to just stop and listen. And I did my part. I went to the best, most fanciest doctor in Dallas who was on all the magazines. She had all the awards and all the degrees because this is the baby I had worked for years. I completely transformed my body to carry this baby because I don't know if I'll be able to have more. So you do everything right and you go to the best and you spend all the money for the best of the best of the best and you're still treated like you're just another stupid girl. And that pisses me the fuck off.
I want to pause here and highlight something that we don't talk about enough, that the statistics on healthcare, maternal healthcare conditions like PCOS and endometriosis for women of color is fucking bleak. Diagnostic delays are worse for women of color. Studies show that women in general wait 7 to 10 years for an endometriosis diagnosis. But for Black and Brown women, that delay is often years longer or they are misdiagnosed altogether. A 2022 study found that Black women are less likely to be correctly diagnosed with endometriosis than white women, even when they're presenting the exact same symptoms. And PCOS, polycystic ovarian syndrome, is often missed or minimized as well. PCOS affects about 1 in 10 women and people assigned female at birth. But Black and Latina women are less likely to be diagnosed early. They're much less likely to receive effective treatment. Instead, they're often blamed for their weight, for their lifestyle, and they're not given real effective answers. And these delays are not just annoying, they are harmful because untreated endo and PCOS can lead to not just pain, but infertility and chronic pain and mental health struggles. So when your providers don't take you seriously, you start to doubt your own body and sometimes blame yourself. That's not just bad medicine, it's potentially traumatic. The bigger issue here is racial bias in medicine. Research suggests that Black women's pain is less likely to be believed and treated. These disparities are not an accident. They are baked into the system, and they have very real devastating consequences for women of color. So when we talk about medical gaslighting, we have to talk about race because the system does not fail all women equally. It fails women of color first and hardest.
Even if we never talk again and you just want a second opinion, I'm happy to do that. I will ask your husband about his medical history. Sir, are you still smoking? I will do it for you because I'm not scared because I've already been there. So nothing scares me anymore.
Oh my gosh, Cynthia.
Sorry.
No, don't say sorry. Like, it's really beautiful what you're doing, and you're so brave.
Thank you. I wouldn't say that. I don't think that. It just makes me angry to feel helpless. And I don't want other people to feel as helpless as I did. Those are the most vulnerable times in your life.
There's a specific type of heartbreak that comes from doing everything right, so to speak, trying to be your best advocate, being prepared, even being credentialed and still feeling dismissed or harmed by the system that is supposed to care for you. And it's not just me. It's not just Cynthia. It's the realization that if we, with our knowledge and access, aren't safe, what happens to the people with fewer resources, with less privilege or no one to advocate for them? That's grief, that's anger. It's not just personal, it's systemic. And I have a lot of grief about that. I just write and podcast about women's health, and I hear about this stuff every single day. So this is definitely a tear-jerkery episode for me. Back to the episode.
I do think doctors are good. I don't want to give that impression. And there are wonderful doctors. There are wonderful nurses and midwives. I just think that sometimes we lose the human element, and you need that humanity in medicine because we're not cars, we're not robots, we're intricate, unique people who deserve that time and consideration. And an act of being responsible as a provider is knowing when you're overworked and you are losing that human touch because that puts people in danger too.
Okay, that's it for part 1 of my conversation with Dr. Cyntia Brown. We covered a lot today. How even with a doctorate in pharmacy, she felt dismissed and minimized in her pregnancy care and mental health care. And we talked about what it means to feel like a silly little girl, even when you might be the most credentialed person in the room regarding the prescription drugs you're putting in your body, and how that erasure impacts the safety and the dignity of patients and women in healthcare. Key takeaways: medical gaslighting is real, and it doesn't just happen to women who don't know the medical system, it happens to women inside it too. Being a good patient won't save you from it, and Black maternal health disparities are systemic, not individual failings. And I think advocacy from people like Cynthia should be a prerequisite for respectful women's healthcare. So what can we do based on what we learned in part 1? If you're navigating fertility, pregnancy, mental health care, it is okay to ask your providers hard questions and even change providers. If you are a clinician listening, trust women, believe their pain, ask, don't assume. And if you're angry, good, that makes sense. Share this episode, learn the statistics, and how women and women of color in particular, even Black women in particular, are affected by our medical system. Talk to your providers and your people, and see the show notes to get in touch with Cynthia for consults or a chat or a case review where she actually looks through your prescriptions to give you a better lay of the land. She's actually running a discount from April 25th to May 11, 2025. Mention my name, Micah, when you book a call with her, and you can get that link in the show notes. This is not just one woman's story. This is too many women's stories. And in part 2, coming next week, we will dive deeper into fertility meds, the ethics of pharmaceutical care, and how hormones, particularly oral contraceptives, can impact our mood and our mental health. It is a conversation I do not think you will want to miss. I'll see you there, and till then, take care of yourself.